Hello, everyone. My name is Angie, and I'm a member of the National Member Engagement Standing Committee of APA-ASP. Today, we have two great speakers to discuss the role of community pharmacists in diabetes management. Having a pharmacist as part of your diabetes care has been shown to improve patient outcomes and prevent complications. And community pharmacists, as the front line of direct patient healthcare, play a huge role in it. We have Dr. Castellano and Dr. James to share their experience and dive into various ways you can support diabetes care as pharmacists. So hi, Dr. James and Dr. Castellano.
Hello.
Good evening.
Yes, would you please like to introduce yourselves?
Absolutely. So my name's Adam. I started my pharmacy career at Duquesne University. I graduated there in 2014, and I started with Rite Aid as a staff pharmacist. I was an intern throughout my years at school, and then I continued up through Rite Aid, where I became a pharmacy manager, participated in a lot of our career building programs, and most recently became the manager for the immunization program here at Rite Aid. So a lot of the organizational regulation, planning, all of that for immunizations is what I'm involved in. And I'll turn it over to Joe.
Hi, I'm Joe Castellano. I started my pharmacy career at the University of the Sciences in Philadelphia. I graduated in 2008. I have been working for Rite Aid Pharmacy ever since. I started with Rite Aid as an intern, worked my way up as a staff pharmacist, pharmacy manager, and my current role now is the manager of clinical and pharmacy services. I'm involved in several programs here at Rite Aid. Some of my main responsibilities are our MTM programs and some of our clinical initiatives, such as adherence programs, and some of our educational courses as well. In today's presentation, Adam and I will go over how community pharmacists are perfectly positioned to counsel patients regarding diabetes and prediabetes, how to analyze and interpret their blood glucose results, recommendations for annual screenings for our diabetic patients, ensuring that we are administering diabetic patients the appropriate vaccinations, and preventative measures to help avoid diabetic complications. Let's review diabetes and prediabetes. Diabetes is a chronic metabolic disorder that is defined by hyperglycemia caused by a deficiency in insulin secretion and a deficiency in insulin efficacy, or both. It is a complex disease with serious comorbidities. About 1 in 10 Americans, more than 34 million people, have diabetes, and 1 in 5 remain undiagnosed. 1 in 3 American adults, about 88 million people, have prediabetes, and more than 8 in 10 are not aware that they have it. Adults with diabetes are more likely to be hospitalized with cardiovascular disease, end-stage renal disease, lower limb amputations compared to patients without diabetes. Diabetes is the 7th leading cause of death in the United States, and the risk of early death for adults with diabetes is 60% higher than for adults without diabetes. A study published in the Journal of Managed Care and Specialty Pharmacy found that adding pharmacists to the diabetes care team not only improves patient outcomes, but can help prevent complications and reduce costs. We'll take a look at the 4 main types of diabetes. Type 1 diabetes represents 5 to 10% of all diabetic patients. It is characterized by a complete lack of insulin secretion and is thought to be caused by autoimmune destruction of the beta cells of the pancreas. Individuals with type 1 diabetes require exogenous insulin to survive. Currently, there is no way to prevent type 1 diabetes. Certain risk factors for diabetes, type 1 diabetes, includes age. It mostly affects children, adolescents, and young adults. Family history, risk increased if a parent or a sibling has type 1 diabetes, and race. In the United States, whites have a higher risk of developing type 1 diabetes than African Americans and Hispanic Latino Americans. Type 2 diabetes is the most common type of diabetes, representing approximately 90 to 95% of diabetic patients. It is characterized by the decrease in insulin secretion and/or a decrease in insulin sensitivity. Type 2 diabetes develops over many years, during which patients are considered to have pre-diabetes. Risk factors for type 2 diabetes includes weight. Being overweight is a primary risk factor for developing diabetes. Lack of exercise, being physically active less than 3 times a week increases your risk. Diet and age, people over the age of 45 are at higher risk. Certain family history. Smoking, smokers have a 30 to 40% higher chance of developing type 2 diabetes and heart disease than non-smokers. Ethnicity and race, those who are African American, Hispanic, Asian American, Native American, or Pacific Islander descent are at higher risk of developing type 2 diabetes. Prediabetes affects approximately 88 million American adults. It is characterized by slightly elevated blood glucose levels, but not high enough to be diagnosed as diabetes. Prediabetes increases the risk of cardiovascular disease and is a precursor to developing type 2 diabetes within 5 to 10 years if not managed properly. Fortunately, unlike type 1 and type 2 diabetes, prediabetes can be prevented and or delayed by taking proper lifestyle changes. The risk factors of developing prediabetes are similar to what we have just spoke about for type 2 diabetes. Gestational diabetes occurs in 2 to 10% of all pregnancies in the US. It occurs when the body cannot make enough insulin during pregnancy in a woman who does not currently have diabetes. This type of diabetes is typically tested between 24 to 28 weeks of pregnancy and can often be controlled through diet and exercise. However, sometimes insulin is needed for treatment. Next, we're going to talk a little bit about analyzing and interpreting self-monitoring of blood glucose results. It is important for patients to monitor their blood glucose levels as directed by their healthcare professionals. It is just as important for the patient to understand their blood glucose goals. Let's look at a few ways patients can monitor their blood glucose at home. First, we have traditional blood glucose monitors. These glucose meters vary in cost and size. You can help your patients choose the proper meter by discussing cost, insurance coverage, and any added features that may suit their individual needs. Some features of these meters include audio capabilities for the visually impaired, illuminated screens to help in low light, large, easy to handle buttons and easy to read screens. There also is meters that have additional memory and storage so that you can look back of your history of how your blood glucose levels are. Some even come preloaded with test strips for those who have dexterity issues. Some of the more technologically advanced meters have the ability to download the results on your computer or your smartphone app and create graphs to see how your glucose levels are trending over time. Similar to traditional blood glucose levels, alternate site glucose monitors allow blood samples to be retrieved from areas other than the fingertips, such as the arm, palms of your hands, or your thighs. They may not be as accurate as fingertip samples when blood sugar levels are quickly rising or falling, but they still remain a great option for patients who wish to rotate testing sites. One of the newer types of monitors that are on the market are continuous glucose monitors. These devices require a prescription and use a sensor which is placed under the skin to measure glucose levels in an interstitial fluid, roughly every 5 minutes throughout the day and night. The sensor sends a reading to a small reusable transmitter, a smartphone, or even a smartwatch, depending on the brand. A nice feature is that patients can set an alarm to alert them when their blood glucose levels are out of range. These products are expensive and require sensor replacement every 7 to 14 days. In addition, patients may need to check blood sugar levels with traditional monitors to confirm readings and to program the device. The readings and the data can be shared with their caregivers on their smartphone or on their app. Pharmacists should be aware of this technology and become familiar with the various features of each system, which will enable them to instruct patients on ways to use these new devices and prevent disease progression and complications. As pharmacists, it is our job to inform customers of potential medication interference and complications. Certain common medications may interfere with continuous glucose monitoring readings, such as acetaminophen, tetracyclines, lisinopril, atenolol, and even red wine. Always refer to specific product labeling for more detailed information before making recommendations to customers. We also have at-home hemoglobin A1C testing. The hemoglobin A1C test is a good indicator of the average amount of glucose in the blood during the past 2 to 3 months. This test may be done at home using a self-test kit to evaluate the risk of developing diabetes, to diagnose diabetes, to monitor long-term control of blood sugar in patients who have diabetes, and to help make critical treatment decisions. Even some customers with prediabetes may be curious to determine if their lifestyle management strategies are working. Suggest an over-the-counter hemoglobin A1C test to these customers so they can gauge their average blood glucose levels. It is important to help patients interpret the results and refer them to a physician when necessary. Who are these tests? Who is an A1C test indicated for? It is recommended that adults age 45 and older test their A1C at least every 3 years. For adults with a diagnosis of prediabetes, it is recommended to test their A1C annually. Adults diagnosed with diabetes who are meeting treatment goals, it is recommended to test their A1C twice a year. For adults with a diagnosis of diabetes who are not meeting treatment goals or have recently changed or added new medications, it is recommended to test their A1C every 3 months. There are some other ways that pharmacists can help with preventative screenings. A program that Rite Aid has done is partnered with a lab and regional health plans to provide at-home test kits to the members who shop at Rite Aid. Because preventative screenings are a valuable healthcare tool to help close gaps in care for our customers, we have offered these highly accessible preventative care tests at no cost to the customers. So how this programs work is we've partnered with a health plan to identify their members who would benefit from select preventative screenings. Rite Aid will then identify these customers while they're filling prescriptions in our store, or proactively reach out to our customers to recommend they perform these test kits at home. The patient will perform the test at home, and they will then package a sample and send it to the lab where they can analyze their results. They will provide the results to the customer and also to their primary care physician. The pharmacist is there along every step of the way and can answer any questions they have about how to perform the test and how they can interpret the results and what their next step should be. Here are 2 examples of test kits that we have available at select Rite Aid stores for customers identified by their health plan in need of these preventative screenings to support diabetes. The first test is a microalbumin specimen collection kit test that is used to screen for albumin in the urine, which can be, if positive, can be an early sign of kidney disease in people with diabetes. The A1C specimen collection kit measures the patient's hemoglobin A1C level which we talked about earlier, measures the average amount of blood sugar in a person over the past 2 to 3 months. These are simple home test kits that can be completed at home by the customer. For the A1C test, we also have the option of the customer completing the test in the store under the supervision of the pharmacist. This allows the pharmacist to guide the patient through the collection process. The goal of this program is to make completion of certain screenings as simple and easy as possible for the patient, and show the value of the pharmacist by ensuring the successful completion of these annual preventative screening tests. I'm now going to turn it over to Adam.
Thanks, Joe. Go ahead and hop to the next slide. So what I'm going to talk about is some of the ways that we can prevent complications in our diabetic patients. Before we get into that, though, I'd like to talk a little bit about a diabetic's physiology. We all know that diabetics are more prone to infection, but sometimes the reason behind that isn't quite clear. What it really all comes down to, though, is that they have a higher blood glucose level than your non-diabetics, and this is whether they're non-controlled or controlled. Even your best controlled diabetics are going to have a higher blood glucose than a non-diabetic. This can weaken a person's immune system. It can cause peripheral nerve damage, which may allow them to not know when they have an infection. You'll see that on like the bottoms of the feet, and we'll discuss that further as we go along. And then also just the higher blood glucose in their blood allows for an environment for bacteria to grow and for infections to develop and become serious more quickly. So if you look to the image I have here to the right, I want you to really understand that it's a vicious cycle when a diabetic gets an infection. So because they have a high blood glucose, they're more apt to develop an infection. When they have an infection, it then becomes harder for them to control their blood glucose. They may see blood glucose spikes. This then makes it a lot easier for that infection to progress quicker and become serious more, quicker. And then in turn, then back through the cycle where, it just keeps kind of compounding on each other. So that's why we want to really focus on the prevention rather than treatment for infections for our diabetics. Next slide, Joe. So a few common infections that we do see in our diabetic patients that we really want to be conscious of are those of the ears, nose, and throat, upper respiratory infections like flu and COVID, urinary tract infections, which can progress to kidney infections and more serious ones very quickly. And then skin and soft tissue infections, which is what you'd see here to the right, like the diabetic foot ulcers, which can lead to, as Joe had mentioned earlier, amputations, gangrene, and even death. So how can we avoid these infections? How can the community pharmacist play a role in making sure that our patients are protected? So the first three here that I don't have in bold are ones that we've sort of already talked about, or maybe just good counseling points. Obviously, this first one Joe went through pretty heavily with the glucose level testing, testing regularly, all the different options, maintaining personal hygiene and not sharing insulin pens or testing supplies or needles is always very important. But these next ones here that I have in bold are the ones that we're going to go into in detail. So having a sick plan and knowing when to seek medical care. As I mentioned, it's not uncommon for a diabetic who has a regular infection to progress to a serious infection very quickly. So knowing when to seek medical care could be the difference between full recovery and life or death. We want them to get vaccinated against vaccine preventable diseases. We want them to wear appropriate footwear, attend regular checkups with any doctor that they need to, and then also do everything they can at home, which a lot of the at-home test is what Joe already talked about, but there will be some other ones that I'll discuss as well throughout the presentation. So first, we'll talk about our diabetic sick day plans. What we first want to acknowledge is that all people get sick, and diabetics are no different. But when diabetics do get sick, we want to make sure that they have a plan to manage that sickness and just take the extra care that they need. So while they're sick, we've already discussed that blood sugar can be definitely harder to control. And so having this sick plan created with the help of a doctor is very important. And it says doctor here, but I want to keep, to kind of bring it to the front here that, pharmacists are becoming more and more a part of diabetes management in every aspect. So while this is traditionally been created by a doctor. Pharmacists can be heavily involved in this process and can even, kind of maybe fill in the gaps that, the patient didn't understand at the doctor's office, or, maybe something that they weren't quite sure of while they were there. So the components of a sick day plan, we want to make sure they're taking their insulin and diabetes medication as usual. A lot of times when someone's sick, they may forget to take medication. They may think, well, I should take more. They may skip oral medications if, maybe they have an upset stomach or something like that. We really want to make sure that they're consistent with their medication. We want to make sure that they continue to test their blood glucose and even test it more often in some cases. We want to monitor their fluid and food intake. And this also, we want to just make sure they stay consistent, stay hydrated, continue to eat the same diet, monitor their weight, because if they were to lose weight, more than 5 pounds, I believe, in the course of an illness is a sign that you could be developing a very serious infection and a spike in blood glucose. And then regularly checking for a fever, because obviously that's a sign of a serious infection. And then testing for ketones in the urine, which is indicative of diabetic ketoacidosis, or DKA, which is a serious complication of hyperglycemia. So knowing when to go to the emergency room is also very important for our diabetics. I'm not going to go down through each one of these, but just know they all kind of relate up to these sick day plan components. So like you see here, like regularly checking for a fever. Down here it says if your temperature is over 101 for 24 hours, go to the doctor. So they kind of go hand in hand, and counseling patients when to go and seek emergency help is, like I said, could be the difference between life and death. Next slide. So the next thing we're going to talk about is vaccine preventable diseases and which vaccines we should recommend to our diabetic customers. Some of these vaccines will be overlapping with regular non-diabetic customers, but these are the ones that we really want to make sure that our diabetics are all getting and are up to date on. So they are influenza, pneumococcal vaccine, hepatitis B, zoster, Tdap, and COVID-19. We'll start off with talking about influenza vaccine. Now, it is recommended for all diabetics annually. The CDC does recommend it by the end of October. This is consistent with all patients, actually, over 6 months old. But it's really, really important for our diabetics. So even those diabetics that have well-managed diabetes, they're at a higher risk of developing serious flu complications, which obviously do include death. All of the statistics I have listed here just kind of drive this point home. They're 3 times more likely to die from the flu, 6 times more likely to be admitted to the hospital. And studies show that in previous seasons, 30% of all adults hospitalized with flu were diabetics. So that's a pretty staggering figure when you think about it. And then also they estimate that from the diabetics that were hospitalized, vaccinating with the flu vaccine could have reduced those hospitalizations by almost 80%. A big common theme here that we're going to see with each vaccine that we recommend is that when a patient is infected with one of these, like influenza or any of the ones that we're going to talk about on subsequent slides, their blood glucose is harder to control, and therefore they have a higher chance of getting that serious infection that we want to avoid. The types of influenza vaccines that we have, big call out here is that we now have all quadrivalent vaccines, but as of the 2021-2022 flu season, that's really important because before we had to sort of be very cognizant and recommend a quadrivalent vaccine for a diabetic customer rather than a trivalent. It's not something we have to worry about anymore, but patients may question, if it is the 4 flu shot or the one with the most strains. Just know that that is the case now. There's a couple different types of flu vaccines, and I don't want to get too much into that because it's not the purpose of the presentation, but just know that there are different ones out there. And if a diabetic customer maybe say has an egg allergy, there are non-egg based options. And then if they are over 65 years old, we want to be recommending our high dose flu vaccines and our adjuvant flu vaccines, which go by Fluzone HD and Fluad. Those are the ones that allow those 65 and older to build a better immunity to the influenza virus. And it's really, really important to make sure our diabetic customers that are over 65 are getting those vaccines because they are the ones that need to build the highest protection against influenza. Next slide. So now we'll talk about pneumococcal vaccines. I will preface this by saying that on 10/14/21, ACIP met and they now are recommending 2 additional pneumococcal vaccines. So if you were out on rotation or you're working as an intern in a store or in any pharmacy really, you may have come across some of the pneumonia vaccines, but now there's some newer ones out there. So we'll kind of give you a brief overview of that too, and just kind of talk about what this means for our diabetic customers. So as is the trend with all of these vaccines, diabetics are at a higher risk of developing serious complications from pneumococcal infection. So, just really important to make sure we're recommending these, the vaccines that we do have available for use. Pneumococcal conjugate vaccine, which I'll just abbreviate with PCV. We have PCV13, which is Prevnar 13. We have PCV15, which is Vaxneuvance, PCV20, which is Prevnar 20, and then PPSV23, which is the Pneumovax 23. The ones listed in dark blue are the newer ones that are now going to be available. Next slide. So for our diabetic patients, those age 65 and those aged under 65 are kind of in 2 different groups. The ones over 65 years old should receive at least 1 dose of pneumococcal vaccine. We're going to start off the recommendation with the PCV type vaccines. So if a PCV13 or PCV15 is administered, we then want to follow it up with a PPSV23 1 year later. If PCV20 is administered, after that, there's no subsequent doses needed for that person. For our 19 to 64-year-olds, they should receive, and this is diabetics, obviously, they should receive a dose of PPSV23 pneumococcal vaccine. And then when they turn 65, they would then come back up to the first bullet point for the 65 and older recommendations. As of now, there is no PCV vaccine recommendation for those 19 to 64 that are diabetic, but ACP has already acknowledged that they are going to discuss this and look into that. It may be a recommendation in the future, so that's just something to keep an eye out for. If that were to be the case, that would be another vaccine that pharmacists would be looking to recommend for our diabetic customers. Next slide. Hepatitis B is another one that our diabetics are at a higher risk of getting, and also at a higher risk of developing a serious infection. So hepatitis B can be acute or chronic, but our diabetics do have a higher risk of transitioning from that acute stage hepatitis B to chronic. Which with chronic, you see cirrhosis, which is scarring of the liver, liver cancer, liver failure, and even death. So obviously diabetics are at an increased risk for this disease because of their diabetes diagnosis in general, but also because they're using injectable medications, they're testing their blood glucose, and hepatitis B is primarily spread through bodily fluids, and blood would be included in that. So the recommendations for hepatitis B vaccination for our diabetics who are under 60 years old, we always want to recommend they get a hepatitis B series. If they've already had one, there are titer tests that they can do to make sure that they're fully protected. But if they're unsure of their vaccination status, or they don't think they've been vaccinated, that's definitely one we want to recommend. Those over 60 years old, it is recommended that the patient and their physician look into it and decide together on that. And it says the discretion of their healthcare provider, because it really can be any healthcare provider, not just a doctor. A pharmacist is very capable and sometimes even more capable of making that recommendation to the patient. Next slide. So the hepatitis B vaccines that are currently available, there's 2 types. There's the recombinant vaccines, and then there's the recombinant and adjuvanted vaccine. The recombinant vaccines, which go by the names of Engerix B and Recombavax HB, they're both 3-dose series, and they're administered like today, and then 1 month from today, and then 6 months from that next dose. The recombinant and adjuvanted is Heplisav B. It's only a 2-dose series and administered like today, and then 1 month from today. As with any vaccine, the goal is to get enough antibodies built up to be considered protected. And both these vaccine types are good at achieving that. The big differences are for the Heplisav-B here, it's only 2 doses. And so that you can get protection faster, and it's less injections for the patients, less times they have to come back to the pharmacy or to their healthcare provider. But then for the Engerix and the Recombivavax, those ones are recommended for all age groups, whereas Heplisav is only 18 and older. So if you are dealing with a diabetic type 1 customer, it would be something to consider that, you know, they would be able to get one of these, but not the Heplisav. Next slide. The next vaccine we'll talk about is the zoster vaccine. And this one, again, has new recommendations as of 10/14/21 by ACIP. And this does directly affect diabetics, which was a great time to have this discussion. So the longstanding recommendation for shingles vaccine was that every person over 50 years old receive vaccination. Now, which is the addition to this existing recommendation, is that those people who are 19 to 49 years old who are or will be immunodeficient or immunosuppressed due to disease or therapy should also be vaccinated. So what that means is our diabetic customers, especially those who are not well controlled, should receive or should be recommended to receive a zoster vaccine. Now, what shingles is, I'm sure you've kind of heard of it and have a good background on it, but just for completeness, we'll touch on it. It does develop and present as a painful rash. Usually it's very clear when you see it. So like the small pustules that come up, and it occurs in like certain places on the body. So either the scalp, the torso, or kind of around like the neck area. And as a pharmacist, I will tell you that in my practice, you will have a lot of people come in and say, oh, I have this rash. Can you look at it? As a trusted healthcare professional, they're going to ask you that. So being able to identify it and then also give them information on how they can prevent it in the future is a very good thing. And the one thing we always want to talk about with our patients when we're discussing shingles is that the biggest complication from shingles is the post-herpetic neuralgia, or PHN as they abbreviate it. It's a nerve pain that can last months or years, or weeks to years after the rash is cleared. It's sometimes very difficult to manage. Some treatments that they use are Lyrica and other. Sometimes they use SNRIs. But for the most part, if the initial treatments don't work for this, the PHN, it's very hard to control, and it can be a really big burden on patients. And so what we want to think about with the zoster vaccine is that vaccination really does equal prevention. And if you want to go to the next slide, Joe. So as I said, vaccination does equal prevention. And so you see the last bullet point here, just to kind of jump to the punchline. The two doses of our approved vaccine is more than 90% effective at preventing shingles, and then obviously the PHN that would result if you had shingles. So the approved vaccine right now is our Shingrix vaccine. It's a 2-dose series administered 2 to 6 months apart. And something to really be cognizant of while you're practicing is we're going to ask a lot of people, have you had your shingle shot? And a lot of times you'll get a yes, but it's always good to ask a little bit further. So what I found is I'll ask them when they got it. And the reason I ask that is because if they got it before 2017, it was probably the older Zostavax shingle shot, which is less effective. It was a live vaccine, so not everyone was eligible for it. And then it was, like I said, just less effective. And so this now Shingrix is recommended. So if they only got the Zostavax. So a lot of times just asking that simple question, when did you get your shingles vaccine? They may say, oh, it had to be 2010 or something, that then, well, there's probably gonna be recommended for the new Shingrix vaccine. Zostavax, like I said, was a live vaccine. So some of our customers may have not been eligible for it at the time, but Shingrix is not. It is an inactivated vaccine. So it even opens up the possibility that someone who previously thought they couldn't get the shingles vaccine could now get it. Next slide. Another vaccine that I'd like to discuss is our Tdap vaccine. You may also have heard this called like the tetanus vaccine or whooping cough vaccine. It is all the same thing for the most part, but really the main thing to consider is that adults should get a tetanus booster every 10 years, and this includes our diabetics. And obviously it's especially important for those diabetics because of their increased risk of infection. I think I've had this on every other slide, but it really is the take-home message that I want to drive home with these vaccines, that, we recommend them because we are able to prevent these diseases, which is why we call them vaccine preventable diseases. So, recommending these can be the difference between a serious infection and avoiding one. Now in practice, the Tdap vaccine is one that tends to get overlooked. A lot of times when you go to the emergency room, that's when you get it, or during a pregnancy, you may end up getting it then. Obviously, young children are vaccinated with it on a schedule, but as an adult, that 10 years can go by kind of quick, and you kind of don't remember when you got it, or you think, well, it had to have been recently, but it really wasn't. And so as practitioners, we really just want to make sure that we're diligent about recommending this, especially for our diabetic customers. And kind of as a rule of thumb, if someone doesn't know when they were vaccinated last, or they don't think it was within 10 years, it's better to just vaccinate rather than, essentially err on the side of we'll vaccinate now rather than, we'll wait and, if you're not quite sure. The vaccine protects against 3 different things. It's tetanus, diphtheria, and pertussis. I don't want to go into it too much. I just kind of included this here for, your information, but essentially we can prevent 3 different diseases with this one shot. So it is a very important one to recommend for our customers. Next slide. The last vaccine that I'll talk about is the COVID-19 vaccine. It is available. There are 3 different ones available in the United States right now. They're all recommended for our diabetic customers. And it is recommended that each and every one of the diabetic customers receive a primary vaccine series. And it is also recommended that those 18 and older with underlying medical conditions, which would include type 1 or type 2 diabetes, get a booster based on their individual benefits and risks. So most of our diabetic customers would fall into this category of needing it, unless they were really well controlled, had no additional risk factors, which isn't very common. But for the most part, almost every diabetic customer should get a primary series and a booster. The 3 ones that are available are the Pfizer BioNTech, which is also called Community. That primary series is 2 doses, 21 days apart, and then it has a 6-month booster after that primary series. The Moderna, which is 2 doses and 28 days apart, then 6 months after the primary series would be a booster, which is a half dose. And then the J&J or Janssen vaccine is a single dose primary series with a booster dose 2 months after. The main thing that we want to consider when we're talking to diabetic patients about the COVID-19 vaccine is having type 1 or type 2 diabetes has been shown to increase the risk of getting severely ill from COVID-19. We all know the seriousness of the pandemic and the COVID-19 virus. So really just, driving it home that it's important to get vaccinated so that we can prevent any serious complications or give them the best chance to prevent them. Next slide. So we've kind of gone through all the different vaccines that you can recommend. And now, where do we come in? How do we really, be an advocate for these vaccines? And so I first want to highlight the fact that pharmacists, especially community pharmacists, are the most accessible and trusted healthcare providers. You see it all the time, and once you start practicing, and if you practice in if you're an intern or you're on rotation, you can really see how many people the pharmacist gets to talk to on a daily basis in the community setting. So what we really want to do is we want to build off that trust and build off that accessibility and become advocates for our diabetic patients to get vaccinated. Because like I said, these really are vaccine preventable diseases, which is something that, is astounding. And we want to take advantage of and make sure that they are protected. So while discussing with your patients, kind of take these tips. Some of them are ones that I pulled off the CDC website. Other ones are ones from my own practice, but I'm just going to kind of discuss a little bit of the ways that I talk to diabetic customers, and hopefully you can pull something from that. So the big thing is always focus on the positive. So when we educate our patients, we want to talk about the benefits of receiving the vaccine. And most of the time it's going to be, you won't get seriously ill. You have a less chance of getting seriously ill. You can avoid complications associated with a disease, anything like that, that can make them realize that there are benefits just beyond, maybe like surface level stuff that they would think. we want to make sure they fully understand that they are diabetic and that they are more prone to infection. Sometimes diabetics don't know that, and they just maybe haven't ever been told that, or they choose to ignore it. But just maybe explaining to them that because they have higher blood glucose, they are more prone to infection, and this can not only be put them at an increased risk of getting these diseases, but then also developing serious complications or serious illnesses. We want to speak to them with compassion. A big thing with diabetic customers is that you'll find, they always have something going on. So whether it's they're getting their medications changed, or their blood glucose quite isn't where it should be, or the doctor tells them their A1C was a little high, or whatever, they always have something that they're sort of battling. And so to put something else on their plate sometimes just is a little too much for them. And so to really kind of relate to them and speak with empathy, be compassionate, sometimes that can make all the difference between coming across as like, here's one more thing you have to do, rather than, hey, this is something you can do to help you avoid a situation down the road where you have a real problem. Familiarity is a comfort zone is kind of one that it relates back to this very first bullet point that I had. We, as community pharmacists, we know our customers. We talk to them almost daily, weekly, at least monthly. And, being able to have that relationship already built is, it's invaluable. So being able to take that relationship and give a good recommendation for a vaccine can sometimes be more impactful than from other healthcare providers. We want to make it personal. So anytime you can, say, well, I know another diabetic who I recommended these same vaccines to, or, just anything like that is always a good way to sort of help someone make the right decision. And then obviously we want to encourage just open dialogue, remind patients that we're here for them and their health, because in the end, that's really what we're here for as pharmacists. And sometimes, we get goal driven, we get recommendation driven, and sometimes just taking a step back and just letting them know, hey, we're here for you, even if you just want to ask a question and not make a decision on a vaccine right now. Sometimes that can make all the difference, just letting them know that we're really just here to try to make them as healthy as possible. Next slide. So we'll close the presentation up with just a few other preventative measures that can help diabetics avoid complications. And a big one of those is just going to the doctor at the right time and the right frequency. So we want to have our diabetics see the person that manages their diabetes, which would usually be an endocrinologist or a family doctor, every 3 to 6 months. So every 6 months if they're well controlled, every 3 months if they're not well controlled. We want to have them go to a foot doctor or a podiatrist annually, the eye doctor or the optometrist annually, and then the dentist every 6 months if they can, but at least every year. We also want to make sure that they're performing daily habits that are just that would promote good health. So blood sugar checks, as Joe has discussed, the foot checks, which I'm going to discuss on the next slide, medication adherence, which obviously is paramount to managing diabetes, physical activity and healthy eating. Sometimes non-pharmacological factors can obviously affect diabetes more than anything else. So we want to make sure that although we're recommending all these testing and vaccines and everything, that we don't lose this these components of our counseling sessions. So go ahead and hop to the next slide, Joe. And so part of that is, pharmacists can really sort of take an opportunity to talk about foot care, because the only time a diabetic patient is really going to get this type of information is when they go to a specialist like a podiatrist, or if they're at their family doctor and they have a really, really good family doctor, or if they already have problems with their feet. So when I always talk to diabetic patients, I would try to work this into counseling sessions, and just, essentially there's a lot of information on this slide, but essentially if you tell them to just check their feet daily, any changes, assume it's something that could be of suspicion, and seek assistance from a healthcare provider. To do this, they can use a mirror, they can have a family member or friend help, and then just make sure they're doing their daily foot hygiene. So washing your feet daily, not going barefoot, wear good shoes. They do make specific diabetic shoes, trim toenails correctly, change their socks daily. And then also, just never try to do any type of foot care at home as far as removing or scraping or anything like that. That can cause an infection if they go too deep, or they cut or cause break the skin in any way. And as we discussed at the beginning of the presentation here, diabetics are more prone to having peripheral nerve damage. They may not be able to feel those types of things, and that's how diabetic foot ulcers can occur. The monofilament test is one that the podiatrist usually does. Sometimes the family doctor will do it as well, and it should be done annually. But they can also buy at-home test kits, or there's like disposable ones that they can buy. They can do those at home anytime they want, just to sort of make sure that their feet are still, they have the sensation that they should, and that they're not, that the peripheral nerve damage isn't progressing. Obviously that has to be done with a family member or a friend, but if they have a good support system, this is definitely something that they can do at home too. Next slide. So just to kind of summarize everything that Joe and I have said today, really, pharmacists are in a prime position to support our customers and provide resources and information to help them stay healthy. So when we're counseling our customers on lifestyle modifications and all the available remedies and resources that can make their lives with diabetes simpler, we just need to realize that that's a key component of our jobs. And to really just take that as our responsibility, advocate for them to do all of these things that, the testing, the vaccines, the daily healthcare, all that stuff. And just, in the end, a positive, informative conversation can have a significant impact on their health. So I think that's the biggest take-home message of the presentation. And we just hope you guys enjoyed it, and hope you learned something today.
Yes, thank you both so much for your presentation on community pharmacist role in diabetes management. We have a few questions for you. So first of all, you mentioned that there has been a new ACIP recommendation for zoster that directly impact diabetic patients. What's the best way for student pharmacists or patients to stay updated with new immunization guidelines?
So attending the ACIP meetings is a great way to kind of, I'm a preceptor for Duquesne University, and every one of my students I have them go through and sit in on the ACIP meetings. They really learn a lot because you get to see the process behind how recommendation changes occur, everything that goes into consideration, all the voting, the discussions that happen. And yeah, I mean, that's really the best way. The other way is to, check back to the CDC site regularly. ACIP, they all will post updates there. But if you can attend the meetings, I think it's the very best way to know it inside and out, and have a really good understanding of how that change came to be, and not just what the change is.
Yes, thank you so much. And everyone else in the meeting, feel free to raise your hand, turn on your camera, turn on your microphone to ask any questions. You can also feel free to put them in the chat as well. Actually, I just see a question was asked. Is there an age recommendation for PCV 15 or 20, or is it still being determined through ACIP?
So I don't think there's a definite age range that they have that's like on the table for voting or anything like that. I imagine that it would be in that 19 to 65-year-old range, or maybe 49 to 60 to 64, but it would be for it would be the lower below 65 population.
Yes, thank you. Another question, recognizing that minorities are more likely to be affected by diabetes as well as social determinants of health, how do you both feel as pharmacists can address these determinants in a community setting?
You want to take a stab at that one, Joe?
Sure. I mean, as pharmacists, it is our job and duty to make sure that we're providing education to all of our customers. So if we see somebody that is in need of that education or is in need of some additional resources, we should try to do our best to help them find those resources, or find a primary care doctor, or in diabetes, it's to find them an endocrinologist, make them a recommendations, kind of provide those connections for healthcare to be able to ensure that they're seeing the proper doctors, to ensure that they're seeing their as Adam was speaking, seeing a foot doctor every year, ensure that they're seeing an eye doctor every year, following up with their primary care doctors, making sure that they're having access to testing if they're not sure if they have diabetes, if they're having symptoms, to be able to recommend these testings, and even finding ways for them to receive free testing.
Yes, thank you. And another question is, how do you think your impact on diabetes care have changed throughout your positions at Rite Aid?
I mean, I'm sure Joe and I would probably have the same answer for this, but I mean, throughout both of our paths, clinical services has been a main focus, whether it be MTM services, immunization services, all these things that directly impact a lot of our diabetic customers. I know, a lot of health plans, the MTM is all based on the different types of medications you're on, and a lot of them are ACE inhibitors, oral diabetic meds, statins. So, those were our customers that we were mostly talking to on a daily basis. And then immunizations, a lot of our diabetic customers are the ones that we're recommending these immunizations to. So, along the path of helping patients and really making sure that they were managed correctly, that was recognized, and that's how I think both of us kind of got the opportunity to join the clinical team and have an impact at a higher level. We both really appreciate the opportunity, because this is a great position to be in, to have the opportunity to speak to groups like APHA, and then also just to be able to talk to a lot of our stores and a lot of our pharmacists in the field about this stuff. So yeah, essentially being able to do this, or to impact the diabetic customers at the store level and the field level, essentially pushed us right up to where we are now, and we are really appreciative for all the opportunities.
Yes, thank you. And I think that's very unique, because I think a lot of the times when student pharmacists think about community pharmacists, they often think about direct patient care and making impact one patient at a time, and not really on the bigger scale. But I can see how being in these positions, you can impact patients in a larger sense as well. Yes. Another question is in the chat. So you mentioned there were 2 additional pneumococcal vaccines added to the ACIP recommendations, but currently the PCV 15 and 20 are not directly recommended for diabetic patients age 19 to 64. Would you know when they will be available for diabetic patients?
So as of right now, yeah, they're not. I mean, if a doctor may write a prescription for a high risk diabetic. I mean, it happens now where they are, some diabetics will get the Prevnar 13. It's available and they're not 65 yet. So it would be based off, prescriber. If the prescriber wrote a prescription for now, I don't know when ACIP is going to vote on that. They just mentioned that they would be considering that for future meetings. As far as availability of products in general, they are available right now. It just hasn't become widespread available, and the recommendations are still fairly new. So at least Rite Aid internally, we're pushing that out to our pharmacists, that information. But just with everything with COVID and flu season, those are kind of taking priority right now. And so I think as we move past flu season, this will be a really big focus for us. Both the PCV 15, 20, and then the Shingrix updated changes, making sure our pharmacists are aware of those and actively advocating our customers, especially diabetic customers, get those types of vaccines.
Sounds good. Another question that we have is, how can student pharmacists help patients in their diabetes management?
Student pharmacists can help their diabetic patients in similar fashion to the way that pharmacists do now. It's just to be there to answer their questions, to know the guidelines, know what they should be recommending to their patients, to ask the right questions, ask open-ended questions, try to get to the root cause, know what's out there for them to recommend. Like when we were speaking about the different meters, try to find the right meter that's correct for them, different things like that to get down there on a personal level with each and every one of their patients and find out what they're truly in need of.
I see. Thank you. A question came in regarding resources that pharmacists or patients can use that they can use for vaccine coverage if their insurance doesn't cover it. So for example, if a patient's insurance doesn't cover a Shingrix vaccine, how could that patient get financial support for that vaccine coverage?
So I think, it's going to depend on the vaccine, because a lot of times, like Shingrix is still fairly new. So there may be some manufacturer coupons out there that they'd be eligible for. Kind of depends on what plan they have, if they have federal or state funded insurance or private insurance that's not covering it. But honestly, in my experience, I've really found that a lot of our diabetic customers, if we or the doctor is willing to go through a prior auth process, you're able to get them covered based on the diabetic diagnosis, because insurance plans realize that the financial impact of a diabetic getting pneumonia or something like that, shingles or whatever, could be more serious, and just cost effectiveness down the road. So, sometimes taking the extra step, really the pharmacist is probably the biggest resource, whether it be looking for some of those manufacturer coupons or appealing directly to the insurance company or getting, recruiting the doctor's office help to get some of that prior auth work done, is the biggest resource.
Yes, thank you. Oh, was there something you wanted to add, Joe?
Oh, I was just going to say, a lot of times, like if you check with your local departments of health, they will have vaccine clinics available, not for just flu shots. Sometimes you'll see them have the pneumonia shots available as well. So that's another resource that patients can look into.
Very good point. Yep.
Yes, thank you. I think we have time for one last question, if there's any in the audience. But going back to the preventative health, I think it's really important for pharmacists and student pharmacists to help patients understand the importance of preventative health, because just getting the flu vaccine helps them, like the risk of hospitalization, like days spent at these care.
Hi, sorry, I was just chatting with Elise to ask a question. I know, Joe, you had talked about staying up to date on current guidelines for pharmacy students. And so my question was, these current guidelines for diabetes are strongly recommending like GLP-1s or SGLT2s. But I don't know if you guys have noticed this, but insurance doesn't like covering those a lot. They're very expensive for patients. So just wondering if you have any like advice on navigating that insurance coverage, or how can we help our patients get these good options that provide so many benefits for them?
I know for a lot of the GLP-1s, if the customers don't have state or federally funded insurances, there's a lot of copay cards out there that are provided by the manufacturers. So sometimes you just have to do a little bit of digging to see if you can find some of those coupons that are available through the manufacturers. A lot of them have patient assistance programs where they can show their financial eligibility to see if they qualify for different programs. And then, as Adam was saying earlier, it's the prior authorization process. If anybody's had experience with prior authorizations, it's not a fun process for the patient, the customer, or the physician. But sometimes if you go through that process to try to work to get those covered, they do have added benefits, and they are in the more recent updated recommendations.
I hope that answered the question.
Is that?
Yes. Sounds like it was answered. Thank you.
Yep.
Any other questions for our guest speakers today? If not, I would like to thank you all for coming at today's event. Thank you, Dr. James and Dr. Castellano, for speaking. And I hope this was an information session for everyone about diabetes management in community setting. Thank you so much for coming and have a wonderful rest of your evening.
Thank you.
Thank you. Everyone have a nice night.